As the CARICOM lead spokesman on matters to do with health, I am pleased to report that the Caribbean is leading the world with the elimination of the mother-to-child transmission of HIV and syphilis. This is, of course, a result of the strong political commitments to public health and making the health of mothers, children, and families a regional priority. Over the last 6 years, we have been able to reduce new HIV infections in children by more than half. This is an amazing achievement given the high rates of HIV in the past. And this success story we intend to improve upon even more in the future.
The key achievement I can speak about from my island, Barbados, was our program, our National HIV Commission and the Ministry of Health, and the program that was in place of the testing of women that were pregnant, the constantly education within the community. Civil society play a key role within any program, any policy that a country have to put out there.
The coordination and the link between the public sector and the private sector is actually very strong, because at some point in time, during the antenatal course and also at the end when they're ready for delivery, they come into the public system. So there's literally 100% capture.
We ensure that we have decentralized services, not just only in the public health system, but it's also free services are available in the primary health, private health system. If you want to have HIV testing, if you are diagnosed, you get free care and treatment, even if you go into the private system, and that's provided by the Ministry of Health.
We have to continue to make sure our staff, especially the new ones, and even the old ones, we have to reinforce the policies and procedures that we have.
What we have been doing, throughout the years is trying to institutionalize these procedures to ensure that it doesn't matter who comes into the system, that they're doing the same thing all the time.
We started with an opt-out system where we kind of bundle it in with all the antenatal testing, right? So syphilis, HIV, everything was bundled in with the regular antenatal screening. And most women did not opt out.
As a matter of fact, let me tell you this. I go out and look for them. Okay, I go and look for them just so that they can start early prenatal registration and care. And in the event of any, I do educate them as to the possibilities of problems during pregnancy.
So we have seen a change in behavior over the years, and we have ensured that we support that with comprehensive sexual and reproductive health policy. We have ensured that we provide family planning and cater to their human rights, that it is okay, you can reproduce if you want to, even if you're HIV positive.
I have a son and a daughter. My son is 7 years and my daughter, she's soon to be 1 year old. She's wonderful. She is the typical year old. She does, she does things that just really give me reasons to go on.
We have trained community leaders to conduct rapid testing. So we ensure that everybody can have availability and access to early detection.
One of the most important things would be to make sure that the public is educated and understands the importance of testing, why we're testing, and why we need to know their status and, to be able to prevent transmission.
I think it has worked significantly well within the antenatal population because the message is really about saving the baby's life, about doing everything in our power to ensure that that infant isn't going to contract the virus.
Mr. même dit prend médicament fait à cause sucre ou fait ou prend médicament pour sucre supposé boire chaque jour. Et on après fait test pour lui normal, mais j'étais toujours quand même un petit côté pour lui. Mais je viens faire deuxième test encore, je vois un côté normal.
Generally in Grand Cayman, both for pregnant women and non-pregnant women and male partners, there doesn't seem to be any stigma in regards to getting a test done. Actually seem to be quite relatively open.
And when you go to the clinics and the hospitals, it's not like, oh, you're HIV, you sit on that side and this one sit on that side. Nobody knows. When the nurses speak to you, nobody knows what they're saying. They always speak to you and you know, it's always a private conversation. And I generally feel, you know, very free and feel very comfortable.
I would like to congratulate the governments of these countries that are following the example that Cuba set 2 years ago.
I'm so excited about our validation. The members of staff worked so hard to see this dream become a reality.
It's rewarding to know that after a long road, we finally get to the point that it can be officially validated that we have achieved elimination of mother-to-child transmission of HIV and syphilis. Now, it doesn't finish here. We have to maintain that.
This is important for the Caribbean because it says that to have arrived at this juncture that we have had to guarantee access to health services for pregnant women. It means that there is some advance in terms of human rights, access to medicines and treatment, and importantly that we have been able to follow up these women for a period of time. So it means, one, it's a maturing of the systems, the health systems in the Caribbean. It's also the fact that persons infected with HIV feel more comfortable to go to health services and to seek treatment, and that the treatment and the care is available.
The hope is there that one day, and which one day soon 2020, that it will be.